Good afternoon, everybody. Welcome to the 2022 Seminars in Aging series run by the National Aging Research Institute. My name is Bianca Bridgenath. I am the Division Director of Social Gerontology and also part of the NARI education team. I would like to begin our session today by acknowledging the traditional owners of the land on which each of us are meeting. For me, that is the Wurundjeri people of the Kulin Nation, and I pay my respects to their elders, past, present, and emerging. Before we begin with our presenters today, just a little bit of housekeeping. At the conclusion of the talk, we will have time for Q&A. And if there are any burning issues after each presenter, we'll also have a little opportunity there to ask one or two pressing questions. If you have questions, you can put them in the chat function, which will be opened at the bottom of your screen. Alternatively, you can certainly raise your hand or put your screen on and you can ask your question directly as well. Today, we're very excited because we have two presenters who will be talking about elder abuse and COVID-19, the prevalence, learnings, and preparedness for disaster. Elder abuse has certainly been part of the silent pandemic that's accompanied COVID-19 and less talked about, but a very, very crucial issue. We're really excited today to actually have with us Dr. Kaspiew, who has been leading the National Prevalence Study. I know many of us have been waiting with bated breath for the results of that. And even though it was released on the 24th of December, we're not going to let this one slide. We're going to hear about it from many different avenues, and we're really excited that Ray is here to talk about it today. So just a brief introduction to Ray. She is a social legal researcher with expertise in family law, family violence, and elder abuse. And prior to her appointment as Deputy Director of Research, she was the Executive Manager of the Family Law, Family Violence, and Elder Abuse Research Program at the Australian Institute of Family Studies. She has been involved in an extensive range of studies and is the lead author of two large-scale evaluations of successive waves of reforms in family law, the 2006 and 2012 reforms. And she led the team that completed the National Elder Abuse Prevalence Study in 2021. Themes included in her work include the extent to which systems and services meet the needs of people affected by elder abuse and family violence. So I'm with great pleasure and excitement, we welcome you today, Ray, to tell us about the National Prevalence Study. Over to you.
Thank you, Bianca. And it really is a great pleasure to be here and to be sharing the findings of this research, which you know, it's a very important project. It's a very big project. It's been a long time in the making, and being able to be here finally and be talking about these findings is really an enormous pleasure, I should say, in inverted commas, because of course we are talking about a very serious topic. I just want to acknowledge that I'm coming to you from the lands of the Wurundjeri people, the Boon Wurrung and Boonwurrung tribes from Melbourne. I just want to, before I embark on this explanation of just some very brief, really, oversights of the findings of the study, I just want to make it clear that the views that you're hearing today are my views as the author and the views of my team. It was a very big team effort. I have a number of co-authors on this paper. So we're not giving you an Australian Institute of Family Studies or an Australian government view. It's a research team view. I'm going to talk briefly about three issues. First of all, a little tiny bit about the background to the research and the definition we applied in the research, then sharing key insights on prevalence, perpetrators, and help seeking, and then some conceptual insights on what we still need evidence on, as well as just a very brief couple of points on what a complex phenomena we're dealing with in elder abuse. So many of you will know, but maybe this is new to some of you. There was a very long gestation for this piece of research. It was one of the recommendations of the Australian Law Reform Commission's report on elder abuse, which was released in 2017. Among many other recommendations, the ALRC called for a national plan to combat elder abuse and research on the prevalence of elder abuse. There were a number of pieces of work that led up to the prevalence study. A scoping paper that was published in 2016 and informed the development of the ALRC terms of reference. Our piece of work on understanding issues, frameworks and responses. We then did an elder abuse prevalence scoping study. Then there was another preparatory research program that involved the development of a definition background paper, a technical report on survey design, some research by the Social Policy Research Centre on Australian Bureau of Statistics data sets, and another piece of work from the Australian Institute of Health and Welfare. We've had many advisors and collaborators, including NARI, along this journey, and we're very grateful for the support that we've had from all of the groups and organisations that have been involved. So the definition that we applied in the research is one that was custom developed for this piece of work. It's very similar to the WHO definition, but it does have one element of difference. So our conceptual definition was a single or repeated act or failure to act, including threats that results in harm or distress to an older person. These occur where there is an expectation of trust and/or where there is a power imbalance between the party responsible and the older person. And the element of that definition that is a little different to the WHO one is the explicit reference to a power imbalance. We looked at the 5 core subtypes: financial, physical, sexual abuse, neglect, and psychological abuse. And we also had a called sub-study that examined a construct called abuse relating to language and culture. I will turn now more to a little explanation of the specific aspects of the study I'm sharing today, an overview of prevalence, the profile of people who experience elder abuse and neglect, profile of perpetrators, and help-seeking behaviours. Just to give you a very brief introduction to the methodology of the study. Of course, this is something as a researcher I could talk about a great deal more, but I won't. So the findings that you're hearing today are based on a nationally representative study of 7,000 community dwelling Australians aged 65 and over. So they were the people we interviewed for the survey of older people. I want to stress that this is a community dwelling sample. It excludes people in residential care, and it excludes people who, for reasons such as cognitive impairment, may not have been able to participate in the study. So the prevalence findings apply to community dwelling Australians. That's a very important caveat to bear in mind when you're looking at these prevalence figures. Another part of the study, which I'm not talking about today, was a nationally representative survey of 3,400 Australians aged 18 to 64, because we wanted to find out what people knew about elder abuse, whether they knew someone who was being, they were concerned about in the context of elder abuse, and how many of them help older Australians, and also the extent to which ageist attitudes are evident in the community. Our culturally and linguistically diverse sub-study was based on analysis of the called subsamples in each of those survey samples. And again, this is not the focus of today's today's presentation, but there are certainly very interesting findings in that study. So turning to the headlines on prevalence, our findings are that the overall prevalence rate among community dwelling Australians aged 65 and over is 15%. The most common form, the most common subtype of elder abuse is psychological abuse at 12%. The next most common is neglect at 3%, followed by financial abuse at 2% and physical abuse at 2%, with sexual abuse at 1%. Of the people who experienced some form of abuse in the study, 4% actually told us that they experienced multiple types of abuse. So when we break down, I guess, the demographic profile of the people who experienced elder abuse in our study, we found that there were limited gender differences. Women were slightly more likely to report an experience than men, and they were also more likely to experience sexual abuse, psychological abuse, and neglect. There is a gender story in this study, but it's quite a subtle one, and it emerges in relation to perpetrator profiles in some of the subtypes of abuse. In relation to age, one finding in our study is that there's the highest prevalence in the 65 to 69-year age group, and that neglect rises for those who are 80 and over. We would be suggesting that these findings are actually an artefact of the nature of the sample, because the people who are in the older age groups and who experience the particular vulnerabilities that are associated with elder abuse are more likely to be in residential care settings, and so their experiences aren't captured in this sample. So that's an important issue to bear in mind. So our findings show very, very clearly that anyone at all can experience elder abuse. But there are some characteristics associated with a higher likelihood. So those characteristics include lower socioeconomic status, particular housing types that are not living in your own home that you own without a mortgage. So the housing types are rental accommodation, either public or private, or a housing type where you have a debt against your home, and also being divorced or separated. So there's an interesting sort of economic and financial status story in the data there. So who commits elder abuse? It's probably not surprising to many of us that family members are the largest perpetrator group. And there is a very strong intergenerational flavour to the perpetrator profiles. So of the perpetrators, 18% of the sample reported they were adult children. 10% of the sample reported they were partners or spouses, and 7% of the sample reported they were sons or daughters-in-law. A very interesting finding is that social connections are also well represented among perpetrator groups. So we had neighbours at nearly 12%, friends at 10%, and acquaintances at 9%. So it's not just family members you have to look out for, it's the social connections as well. And not surprisingly, given the complexity of elder abuse as a phenomena and the differences between the 5 subtypes, we found that perpetrator profiles varied among the different subgroups, the different subtypes, I should say. So For sexual abuse, friends were 43% of perpetrators. Children were 34% of perpetrators of financial abuse, particularly sons. Children were 23% of perpetrators of neglect, but spouses were close to that as well. Children were 18% of perpetrators of psychological abuse, and also 18% of perpetrators of physical abuse. So there's an interesting and varied picture there. When we look at help seeking, basically the findings of this study demonstrate that elder abuse remains a hidden problem. We asked two series of questions about what people did when they experienced abuse. So one series of questions referred to actions, and one series of questions referred to seeking help and advice. We found that 82% did actually take some action to try and stop the abuse, but they were actions that maintained the secrecy of the abuse. So they were things like speaking to the perpetrator themselves, or breaking contact with or avoiding the perpetrator, which was also common. So both of those things both of those responses are concerning in that they maintain the secrecy of the abuse, and they also tend to compound social isolation. In relation to the series of questions about whether you told a third party to get help or advice, we found that 40% of the sample did seek help and advice, meaning, of course, that the majority, 60%, did not. So that, again, is a finding that speaks to the secrecy that surrounds this phenomena. Again, I'm going to be quite brief here because I suspect we may be running short on time. Again, you know, there was a difference in the extent to which actions were taken and help was sought according to the subtype of abuse. And so actions were most common in relation to physical abuse and least common in relation to neglect. You can see a pattern there. Where people did turn to someone else for help, it was most commonly a family member or a friend. Where they turned to professionals, it was most commonly a health professional or a helping professional, and you know, a lower proportion turned to agencies such as police and lawyers. So our findings show a need for an evidence-based prevention framework. A lot of work has been done in domestic and family violence in Australia, and we need a similar push for elder abuse. There needs to be awareness raising of elder abuse, what it is and what services are available among older people, the community and professionals. We need a systematic approach to screening and identification, particularly in health settings. And we need a systematic assessment of existing services as to whether they're appropriate, accessible and adequate. Most importantly, we need to ask older people themselves what they want from an elder abuse response. We also need, I'm going to skip that one. I know we're short on time. We also need more research. As I've said, we still don't understand what happens for people in residential care settings and among the cognitively impaired. We need understanding of the phenomena in LGBTIQ+ groups, Aboriginal and Torres Strait Islander peoples, and deeper insights into the called groups. We do need a longitudinal study on the wellbeing of older Australians that would help us understand causes more than we do now. We understand correlations now, but we do need to understand causes. And there needs to be service development based on a co-design approach. So just a little summary. The study found that nearly 1 in 6 community dwellings Australians over 65 experienced elder abuse in the past 12 months. So that was the time reference period. Psychological abuse and neglect are most common, followed by financial abuse and physical abuse, with sexual abuse at 1%. Anyone can experience elder abuse, but there are some socioeconomic characteristics that are particularly likely to be associated with an experience. And elder abuse is a hidden problem. Most people try to manage it themselves or turn to friends and family for advice. There's a need for prevention, awareness, screening, assessment, and assessment of the adequacy, appropriateness and accessibility of services. I just need to acknowledge the funders, the Australian Attorney General's Department, our co-authors on the research report, as well as all of those reports had advisory groups and collaborators, including NARI, and this really was very much a shared effort. So thank you for listening.
Thank you very much, Ray. I think a lot of food for thought there. There will be opportunity to ask questions at the end, but we've also got a few minutes where if there's any pressing or burning questions that we'd like to ask Ray, we can do that now as well. You can put your questions into the chat or put your camera on and your microphone on and ask Ray directly. Yes, Anne.
Bianca, I didn't even put my hand up. I just put my camera on.
It's all right. You're on the spot now. Did you have a question?
Thanks very much, Ray, for that really comprehensive overview of what is a very extensive report and document. So I'm with Carers Australia, and I'm interested if there was any findings in the survey around where the person experiencing the abuse is the carer of the person who is responsible for perpetrating the abuse. And I also little bit interested in the notion of, or the conceptualization of the person responsible, because in our experience, a lot of carers don't feel that the person is actually responsible for their actions.
Okay, that's an interesting set of questions, Anne. I think what I'll say is that I'm not saying that we couldn't answer that on the back. We haven't addressed those topics specifically in the report. I'm not saying that we couldn't. It's potentially something we could look at. I think one of the main things that I'd like to say in response to your questions is that overall in this particular study, carers emerge as a smaller group of perpetrators, but that's because of the characteristics of the sample, as I've pointed out. And the directionality of the abuse is something, you'd need to unpick a little bit more. But in relation to perpetrators, what I'll say is that the findings quite clearly demonstrate that our participants told us that the perpetrators had many of them were affected by issues such as physical ill health, mental ill health, substance addiction, and financial problems. So, I think there is a lot more that needs to be unpicked in that space.
Thanks very much, Ray.
All right. In the interest of being a ruthless chair and giving Peter his opportunity, I'll move us along. But thank you so much again, Ray, for that really, I think, very insightful presentation. I'm now going to introduce us to Peter Feldman, his presentation is going to examine how Victorian service providers have undertaken early intervention and response to elder abuse during COVID-19 and provide some recommendations to improve the sector preparedness. Now, Peter is a research fellow at NARI and highly experienced in evaluation and working with vulnerable populations. His previous experiences include projects such as older people at risk of homelessness, seniors staying well at home, elder abuse in the context of dementia, 7-year trend analysis of elder abuse data, and a report on integrated aged care into the Royal Commission into Aged Care Quality and Safety. So welcome, Peter, and over to you.
Okay, thanks, Bianca. I shall share my screen now. All going well. Okay, hopefully you can all see that.
Sure can.
Okay, excellent. Okay, so this is the project title. We were commissioned by the Victorian Department of Health and Human Services to conduct this study. The purpose of the project is, or as everyone knew at the time and suspected, the COVID-19 pandemic and the physical distancing measures left many older people much more socially isolated and some more vulnerable to elder abuse. And at the same time, it became more difficult for elder abuse response personnel and providers in general to actually identify, prevent and respond to elder abuse. But at the same time, many providers made adaptations within the restrictions to try and meet the need. So the specific aims of the project were to understand the challenges that the services experienced in preventing and responding to elder abuse, and to learn from the adaptations and innovations that they put into place, and specifically to develop recommendations to government for improving sector preparedness for early intervention and response to elder abuse during future pandemics or other disasters. So the two main research questions were, how did these Victorian providers undertake intervention and response during COVID-19? And based on the information that they gave us, what recommendations can we make? During May to August last year, we consulted with staff from 23 agencies, about 29 staff from 23 different agencies, all who are working at the front line of elder abuse prevention and response in Victoria. And the culmination of that was they were individually consulted. And then the study culminated in an online workshop with participants and the team working together to develop recommendations to government. There's much more information in the study than I can impart here, but basically the key challenges in providing services were that staff in non-critical services, as in non-emergency, non-hospital-based services, basically transitioned to working from home. And we were looking at 2020 in particular, looking back at 2020 during mid-21 at a time when things were almost getting back to pre-COVID before Omicron hit. Client contacts shifted from face-to-face to Zoom, telehealth or telephone. Venue-based support activities, group activities basically stopped altogether. And at the time we spoke halfway through last year, most had not restarted. And where there was face-to-face contact, emergency and health services, crisis interventions, people would be adopting COVID-safe protocols such as full PPE. Now, there were the many unintended consequences of the COVID-safe adaptations were, number one, impaired assessment capacity when using remote technologies such as phone, Zoom or telehealth. There's no substitute for seeing a person where they live. Fewer opportunities to detect elder abuse or risk of abuse. Delayed assessment or treatment, very often from clients cancelling appointments from fear of COVID-19, the fear of going out, fear of having people at their home, isolation of older people from health and care services, family and friends, community activities, and from reliable information. And many older people were on the wrong side of the digital divide for information and services. They, with so many sources being digital or smartphone, and also significantly increased carer stress due to withdrawal of services by the agencies, withdrawal of support groups, and cancellation of services very often by the older person themselves or the carers out of fear of COVID. So now the full impact of the pandemic on the incidence of elder abuse is not known at this point. However, this is what the agencies told us. Overall, the change in numbers of elder abuse cases that agencies saw varied according to the type of service and their geographic location. The elder abuse crisis assistance services experienced no or a slight increase during 2020 and a steep increase in 2021 with greater case complexity. And neglect, physical and financial abuse were the most common. Victoria Police received an increasing rate of elder abuse reports compared with other types of family violence during 2020, and financial abuse reports escalated in 2021. And metropolitan hospitals that were part of the study experienced substantial increases, and by substantial, I mean 30%, 55% increase in elder abuse presentations at emergency departments. Neglect, physical and financial abuse were common, and there was also a surge in injury cases from residential aged care facilities. Aged care assessors, they had a bit of a drop of assessments in 2020, and the client, and hence a backlog of assessments to do in 2021, where they found their clients were generally in worse physical and mental condition than usual. And they also saw high levels of carer burnout. Ambulance services, and keeping in mind that the non-emergency patient transport services, the vast majority of their clients or patients are older people. But for ambulance or the emergency services, they experienced a drop in non-critical call-outs and an increase in serious chronic conditions in 2021. The advisory, advocacy and counselling services, none of them reported a rise in elder abuse calls in 2020, but they expect to see an increase in financial abuse cases in the next few years as the situations that arose or got worse during 2020 and now 2021, eventually in a few years' time, the situation becomes no longer tenable or bearable for the older person suffering financial abuse, and they decide to do something about it. They received many calls from people concerned about COVID-19 and about relatives living in residential care. They saw far more stressful living situations for older people who were living with family members. And there were also at least 2 cases where retirement villages illegally prevented residents from leaving the village. This is retirement villages, not residential care. And also preventing family carers from entering, and it required police intervention to resolve the situation. Now I'll just kind of introduce the rest of the presentation, and we'll kind of we'll organise it around the elevated elder abuse risk. Basically, we have the drivers of elder abuse on the left side and the right side, and the risk factors in the middle. So the drivers on the side of the older people and the carers themselves are lack of IT, technology and skills, and the drivers from the service and society side is that everything's moving over to telehealth and remote assessment, which ends up being a digital divide for older people and many carers too. And on the left side, many people refusing in-home services, and from the supply side, there was withdrawal of face-to-face services. So there's fewer opportunities to actually observe or identify risk of or actual elder abuse. Older people were getting more isolated with fewer social contacts and closure of community groups and activities. Carers are just getting more burdened and more stressed from all sides. So from everything on the left and the right end up causing more carer burden and stress, and especially basically minimal or zero respite options, or the respite options that are available seem very unsafe, and financial strain, obviously, and then finally reduced autonomy of older people from their side, fear of COVID, and from the society side, a lot of ageist discourse. So we'll look at the risk factors one by one. The digital divide and the issue of services and assessments are all being conducted remotely in terms of identifying risk. Telehealth and Zoom, in fact, are better than telephone for conducting assessments. However, many older people don't have the technology and the skills, or a trusted purpose who can help them. A family member who may assist a client with IT, or who might be hovering nearby, might be the perpetrator. It's impossible to gather full information about a client and their home environment remotely. Telehealth consultations become confusing for a client when there's more than one other person involved, such as an interpreter or other clinicians. And electronic signing of documents was, in some senses, a boon, but also becomes a barrier for many people as well. So what some agencies did was they did not stop all home visits. Instead, they triaged clients and made decisions on who were most high risk, and going out to visit them, which is quite a rigmarole when you have to send out 2 people in full PPE. Some agencies provided clients with iPads and assistance to use them. Another workaround was where a person was definitely in a risk situation. They would, by phone, arrange to meet the client in a safe space outside the home, and the client can say to the possible perpetrator they're going to the shops. Sometimes they would even invent a medical reason for the client to go to the clinic or to the hospital to get the client out of the house. Others decided to just limit 1 clinician per telehealth session, especially when using interpreters. Many reverted to just regular postal mail or courier delivery of documents. And the longer term solution, of course, is comprehensive education and support for using IT. In terms of fewer eyes on abuse situations, some solutions were Victoria Police ran Operation Ribbon, and which was specifically for COVID-19, and also the Elder Abuse Response Trial, which had actually been pre-planned. And throughout those 2, they monitored known perpetrators and known high-risk situations, and collaborated with other emergency services better about working together on abuse situations. And a number of community and community home support program services work to educate clients about COVID-19 safety precautions taken by workers, so they felt safe in having people in their home, and ensured that clients had supplies of masks and hand sanitizer. Isolation. Some solutions were community organisations and other providers, kind of because they could no longer hold physical group activities, started up telephone chat groups, pen pals, where staff would kind of actually kind of be the delivery people for the letters, virtual groups using iPads, special food delivery services, and regular one-to-one spot checks of clients. Carer burden and stress. Now, here, because carer support is outside the kind of scope and reach of many of the agencies that we spoke to, there were not a lot of solutions which people employed directly for carers. So it was mostly the indirect support for carers via their other adaptations. And but everyone recognised the additional burden placed on carers at that time, and the additional stress, and there needs to be more done about that. And reduced autonomy. Older people were bombarded with media messages about the dangers of COVID. There were horrendous stats on deaths in aged care and the lockdown in aged care. They were subject to rumour and misinformation if they were just hearing things from family members or wherever. The initial communications, official communications in other languages were riddled with errors. And one outcome of this was that abusers could manipulate the older person via information. So some agencies, community-based agencies, broadcast radio messages in community languages. They had question and answer radio sessions and webinars. Some agencies did pamphlet drops, especially in retirement villages, and other public education programs where possible. There were, however, some brighter side or silver linings. One was the reduced waiting times and much far reduced stress when it came to VCAT and court hearings, because they moved to virtual hearings, which was much better for the older people, with the support of the workers. Most agencies reported greater productivity in terms of their office-based operations. For example, no travel time to go to meetings. Older people who were in hospital actually had greater protection from perpetrators because of the visit restrictions and stringent screening protocols that were in place. People who were experiencing homelessness or had to get out of home were able to use the temporary crisis accommodation set up by the Victorian government for people experiencing homelessness. Some community support agencies said they actually reached new clients, the ones who would normally never attend a physical venue. They were kind of popping up in telephone trees and things like that. And many people reported that older people took up new IT technologies far faster and far better than anyone expected. Not all of them, but everyone was surprised by how well many people did with that. So that comes to our recommendations. Now, on the whole, interviewees said that their agencies adapted well, and they adapted extraordinarily well within the constraints of their regulatory regime and their resources. Nevertheless, many identified ways in which their agency could improve their operations, and everyone was able to make recommendations on how the sector and society as a whole could do better. And I'll just run through these briefly. There were 12 recommendations that were specific to how services operate, and here's just a sample of 3 of them. Agencies should triage new clients at intake so they can prioritise resource allocation, for example, whether to do a face-to-face assessment or if a remote assessment is sufficient. Ambulance services, the emergency and non-emergency patient transport, they need full training in recognising and responding to elder abuse, which is actually in planning and should be commencing shortly. The ambulance paramedics and especially the non-emergency transport, they're in the perfect situation to recognise, identify and assist with elder abuse, but they don't have until now, they haven't had the training or the remit or the referral pathways to do much about it. So that's a big one. And also care agencies should proactively review their client base to identify those most at risk or people who've suspended their support services and check in with them regularly. And then there were 23 universal recommendations. I won't read through them all, but this will be available on NARI's website shortly. Basically, we have a set of 11 around better support for older people, family and carers. One big one, which has popped up in a more recent study, is having community venues for people to go to, for older people to go to. That was suggested by a number of people in this study, and that's come up again in a more recent study. And that's something that we're really keen at looking at. Kind of multi-purpose community hubs for older people for a whole lot of reasons. a number of recommendations about improving the service system. A couple here of you may recognise. More nuanced protocols around COVID-related furlough of hospital staff to prevent avoidable staff shortages. That's been in the news. And more exemptions for services to provide face-to-face services. Some services, there were blanket bans on anyone doing any face-to-face. And that people who were in that situation said it was wrong for their service. And public education, mainly about ageism and elder abuse. And that is it. I'd better finish now. Okay, thank you.
Great, thanks very much, Peter. I think that's a big lot of information for us to digest, and good to know that in and amongst some of the bad news, there was also some good news and things that can be done into the future. We do have some time now for questions, both for Ray and for Peter. Just as a reminder to either put your questions in the chat or to put your camera on and your microphone on, and you can directly ask them as well. While I'll give people a moment to gather their thoughts and type away. We've got Bryony already there. Bryony, do you want to go?
Yeah, I'm really interested, Ray, in some of the differences between what you've found and what the helplines tell us, and particularly around the social contacts being the perpetrators. The helpline data tells us much more that the perpetrators are much more likely to be family members. And did you look at the difference between perpetrator characteristics and likelihood to seek help, if that question makes sense? I was just trying to work it through. Yeah.
Yes, we did. We did, Bryony, and again, look, it's a very complex picture, and the findings vary by subtype. I think what we need to do is think about that question in the context of the overall help-seeking patterns that we've seen. So we know that it's only 40% that go to a third party. We know that it is probably quite a small minority of that 40% that go to the helplines. And so we understand that the helplines see a very particular slice of the community, and we also understand, I think from some of the work that particularly Anna Gilbert in Queensland, Uniting Care has done, there's a sort of particular slice of cognitively impaired clients in the helpline data. And so I think we understand, number one, that the helpline clients are not typical of the population. It's probably quite likely that the helpline data is reflecting people in particularly severe situations where perhaps the abuse has come to the attention of a third party. So, and look, you're always going to get, when you have a population sample and a service-based sample, you're always going to get significant differences, particularly when you understand, as we do, that only 40% turn to a third party for help. So there's a lot more that, we can kind of think about in those patterns, but that's basically the parameters around that issue.
Yeah, no, I do get that. It's just surprising because, you still get 10% spouse perpetrators. That's pretty much the same. There was a big difference in children and others. Yeah, so thanks. I'm so glad. I didn't think I was going to be able to be here today, so I'm so glad I ended up being able to be here and hear your presentation. Thanks so much.
Well, after all those years of working towards this with you, Bryony, it's wonderful.
No, it's good to be at this point, for sure.
Okay, great. I also have a question for you, Ray. With in and around the findings that were made in the prevalence study with regards to cultural diversity. Wondering if we could use the opportunity to invite you to elaborate on that a bit more.
Sure. So we actually found that overall the prevalence rate of the 5 core subtypes of abuse among the called sample wasn't very different to the non-called sample. It was 15.3% prevalence of those 5 core subtypes. If we think about the prevalence of the called specific subtype, abuse relating to language and culture, we find a prevalence rate of 4%. And I think one of the things that we feel is important in terms of future thinking is that when we look at that abuse relating to language and culture, the perpetrator profile is heavily weighted towards the social connections, so that friends and acquaintances and neighbours. There's a slightly less strong familial flavour, both in the called subtype specifically and in the 5 core subtypes for the called subgroups. And the observation that we make in the report is that just as, ageism is an important frame of reference for understanding elder abuse generally, we think that racism is an important part of the conceptual framework for understanding some experiences of elder abuse in called subpopulations.
Great, thanks for that. I think that's very, very fascinating. Other questions from the audience? No, none at this stage. All right. I've got more. I could just do this all day, so I better. But I'll cap myself at this last one, and then I promise I won't ask any more. So this is both for Peter and for Ray. I really wanted to get your thoughts on both your data in different ways reveal, I think, the strengths and also the limitations of current family violence frameworks and how they might need to be extended with regards to elder abuse. And I would wonder if you both could share your thoughts on that observation.
I'm happy for Peter to speak first.
No, you go ahead. You go ahead.
Yeah, well, I think that's really, I think we need to actually spend a lot of time thinking and talking about this, Bianca. And we have to look at a number of different conceptual frameworks. I think, at a very empirical level, elder abuse is family violence in the sense that spouses are perpetrators and children and other family members are perpetrators. But then I think we also need to think more about the issues around power dynamics. So just as power dynamics are a critical part of the theoretical thinking in relation to family violence, particularly in relation to constructs such as coercive control, I think we also need to look at power imbalance in the context of elder abuse and the factors that create vulnerabilities. And this was one of the very interesting things in our findings in relation to abuse by acquaintances, neighbours and friends, is that the people that reported experiencing that kind of abuse also tended to have more of the vulnerability risk factors. So, the things around psychological ill-being, physical ill-being, social isolation. So there is a certain set of characteristics that seem to be linked to experiencing elder abuse from friends, neighbours and acquaintances. And so they're just a few of the preliminary thoughts that that we have on that point. But I think, you know, family violence as a paradigm is useful to a certain extent, but we need to think more deeply about the conceptual, the way that we should understand this conceptually across the core subtypes.
Yeah, I would agree. I see the actually elder abuse and family violence as being intersecting circles. You know, the elder abuse is not the same as family violence. So it's like two overlapping circles, and in the middle is where elder abuse and family is a type of family violence. But outside of that, as Ray pointed out, there's a whole lot of power imbalance issues, and especially when we look at institutional abuse, there was a mention of it in the study I spoke about, where retirement villages were basically abusing the rights of their residents, and these are free citizens. They're not in residential care. They own their properties in this retirement village, and it's not just that; it's abused by in other studies we've heard of, you know, where basically professionals will facilitate abuse, such as lawyers, accountants will actually facilitate abuse knowingly or unknowingly. And then we have the whole world of residential aged care, which is entirely still untapped, and that is not family violence. And unfortunately, at the moment, it's elder abuse is treated like an industrial accident, which is horrific. So there's a whole world to look at outside of family violence, in my view.
Great, thanks very much. Now, just being cognizant of time, I think, could I just ask everyone to please join me in thanking both Peter and Ray with your virtual claps. Not quite as much fun as a real one, but anyway, this is what we'll do in this COVID world. Also, just to let the audience know that our Seminars in Aging is now a fortnightly event. Our next one will be on the 15th of February, Tuesday at 12 p.m. And we will have Ulieta Sabates presenting on dementia and cognitive impairment. So once again, thank you to our presenters today and to all of you for joining us. Have a lovely afternoon. Goodbye.